In this episode of the Iced Coffee Hour, Dr. K discusses the concept of happiness and how it is not necessarily tied to meeting biological or physiological needs. He explains that happiness is not solely dependent on external circumstances, such as vacations or success in work, but rather on how we approach and perceive these situations. Dr. K delves into the idea of attachment and detachment, stating that attachment to outcomes can lead to unhappiness. He uses the example of being attached to the success of a podcast, which can create stress and fear of failure. Detachment, on the other hand, involves accepting the present moment and surrendering to the outcomes, whether positive or negative. By detaching from specific outcomes, individuals can find peace and contentment. Dr. K discusses the third wave of psychotherapy, which involves integrating Eastern concepts into traditional therapy approaches. He explains dialectical behavioral therapy as an example, which focuses on accepting opposing truths simultaneously. This concept aligns with Eastern philosophy of non-duality, where good and bad are subjective interpretations created by the mind. Dr. K emphasizes the importance of therapy as a tool for self-improvement, not just for treating mental illness. He suggests that everyone should consider therapy to gain insights into their thoughts and behaviors. Therapy should be a collaborative effort between the therapist and the individual, with the individual taking responsibility for their own growth and change. The discussion shifts to neuro-linguistic programming, NLP, and the placebo effect. Dr. K acknowledges that NLP may have some success in treating phobias or other issues, but its scientific validity is questionable. He highlights the power of belief and faith in influencing outcomes, citing examples of miraculous healings attributed to spiritual gurus. Dr. K highlights the paradox of happiness, where individuals who lead simple lives with less material wealth can often be happier than those who chase external markers of success. He emphasizes the importance of finding joy in everyday moments and being content with what one has, rather than constantly striving for more. The conversation also delves into the subjectivity of happiness and how individuals perceive their own happiness levels. Dr. K challenges the idea of an objective scale of happiness, suggesting that happiness is a personal and subjective experience. He highlights the importance of finding inner peace and contentment, independent of external circumstances. He shares his personal experience of feeling happy without external stimuli, emphasizing the value of self-awareness and introspection in cultivating lasting happiness. Dr. K highlights the benefits of meditative practice in training the mind to be in the present moment and tolerate discomfort. By tolerating discomfort and staying present in the moment, one can learn to be at peace with both pleasure and pain. He also suggests engaging in introspection to understand the patterns of unhappiness and work towards internal peace. He demonstrates a simple exercise where individuals are asked to close their eyes and focus on physical sensations, such as touch and happiness. Through this exercise, individuals can practice tolerating discomfort and staying grounded within themselves. When discussing the concept of sacrifice in achieving success, Dr. K challenges the idea that sacrifices are necessary for success. He argues that the fewer sacrifices one makes, the more successful they can become. By finding joy in the process and being present in the moment, individuals can pursue their goals without feeling like they are sacrificing anything. He emphasizes that the attitude towards an action determines whether it feels like a sacrifice or a choice. Dr. K delves into the idea of chasing outcomes and the pitfalls of constantly seeking external validation. He explains that imposter syndrome often arises when individuals achieve success but do not feel internally fulfilled. By shifting the focus from external achievements to internal contentment, individuals can avoid the trap of constantly chasing the next goal. Dr. K shares his personal experience of studying in med school and how reducing stress and focusing on efficiency improved his performance. He explains that being stressed can hinder one's ability to enter a flow state where optimal performance and focus are achieved. By letting go of unnecessary stress and focusing on the task at hand, individuals can enhance their productivity and overall well-being. He mentions anchoring his flow state to certain music, like Philip Glass, to help him concentrate and work efficiently. By practicing meditation and concentration, individuals can train their minds to focus on one task, leading to increased productivity. Dr. K discusses the relationship between external environment and internal stability. He explains that changing the external environment can have an impact on one's state of mind, but internal changes are equally important. By training oneself to be internally stable, individuals can reduce their dependence on external stimuli for motivation and focus. The concept of monk mode is discussed, where individuals focus solely on work-related goals and sacrifice other aspects of their lives for success. Dr. K points out that this approach can lead to internal slavery, where individuals become slaves to their desires and goals. He highlights the importance of finding a balance between external achievements and internal contentment. He challenges the notion that external freedom leads to happiness. He explains that striving for financial security is important, but it should not come at the cost of internal peace. Dr. K delves into the causes of burnout, which stem from extreme effort without adequate rewards. He explains that burnout occurs when internal expectations are not met by external outcomes. By detaching from the need for external validation and focusing on one's contribution rather than the end result, individuals can prevent burnout and find contentment in their work. Dr. K discusses the relationship between productivity and happiness. He distinguishes between deriving joy from the process of work versus the end result. By finding contentment in the act of productivity itself, individuals can experience fulfillment and avoid the trap of constantly chasing external goals. He emphasizes the importance of focusing on the present moment and deriving satisfaction from the work itself. Dr. K explores the idea that individuals' responses to negative situations can greatly impact their trajectory in life. He discusses how some people are able to view setbacks as opportunities for growth and learning, while others may be bound by the trauma of failure. He emphasizes the importance of reframing negative experiences and learning from them to move forward positively. Dr. K continues by addressing the concept of anti-work and quiet quitting, explaining that many people are feeling burnt out and disillusioned with traditional institutions like schools and workplaces. He highlights issues such as stagnant wages for teachers, technological crises affecting children, and the lack of training in addressing modern problems like technology addiction in the education system. Dr. K delves into the idea of quiet quitting, where individuals do the bare minimum at work due to a lack of rewards for additional effort. He emphasizes the importance of acknowledging and rewarding employees for their hard work, as well as fostering a sense of gratitude in the workplace. He also discusses the impact of societal expectations for employees to constantly go above and beyond, leading to a culture of overwork and burnout. The conversation shifts to the prevalence of victim mentality in society and its relationship to power dynamics. Dr. K explains that victimhood mentality often arises in response to institutional power, where individuals may feel empowered by claiming victim status in certain situations. He discusses the delicate balance between acknowledging genuine victims and preventing the abuse of victimhood for personal gain. Dr. K explores the complexities of victim mentality, noting that it can both empower individuals who have been wronged and potentially be exploited by those seeking to manipulate situations. He highlights the importance of empowering victims while also encouraging personal responsibility and agency in overcoming traumatic experiences. He also touches on the impact of the Me Too movement in bringing attention to systemic issues of abuse and harassment. The conversation delves into the challenges of navigating false accusations, particularly in cases of sexual assault. Dr. K discusses the dangers of automatically believing allegations without due process, citing examples of individuals whose lives have been ruined by unfounded accusations. He emphasizes the need for a balanced approach that considers the rights of both victims and the accused, as well as the importance of seeking truth and justice in such sensitive matters. Dr. K believes that change starts with individuals and that even impacting a small percentage of the population can have a significant ripple effect. He encourages people to challenge their automatic thinking patterns and gain awareness of their beliefs. By questioning their instincts and seeking to understand different perspectives, individuals can overcome their natural biases and contribute to positive change. Dr. K acknowledges the negative impact of social media on mental health, comparing it to a mental nuclear bomb. He discusses the addictive nature of doom scrolling and the detrimental effects of constant exposure to violent content online. While he recognizes the prevalence of drama-oriented channels on platforms like YouTube, he also highlights the responsibility of creators to be mindful of the content they produce and its potential impact on their audience. Dr. K addresses the question of whether creators are responsible for their audience's actions. He believes that while creators should behave responsibly and consider the implications of their content, they cannot be held accountable for individual actions. However, creators should be mindful of the influence they have on their audience and avoid promoting harmful behavior or inciting harassment. Dr. K expresses concern about the prevalence of violent content on platforms like Instagram Reels and the potential psychological impact on viewers. He discusses how platforms manipulate user emotions to increase engagement and addiction. He notes that constant exposure to violent content can desensitize individuals and prevent them from processing their own emotions effectively. He highlights the need for individuals to be mindful of the content they consume online and its impact on their mental well-being. Dr. K believes that it is okay for partners to make decisions for each other in a relationship. He emphasizes that in a healthy relationship, one partner may overrule the other because they know better in certain situations. He mentions that successful relationships often involve partners acknowledging each other's strengths and weaknesses and being willing to be overruled when necessary. Dr. K discusses the impact of pornography on individuals and relationships. He explains that the increasing availability of niche and immersive pornography can be harmful as it creates a supernormal stimulus that can lead to addictive behavior. He also highlights the negative effects of parasocial relationships in platforms like OnlyFans. He acknowledges that while some people may have healthy relationships with pornography, the trend towards more extreme and abusive content can have detrimental effects on individuals and relationships. Regarding polyamory, Dr. K acknowledges that there are individuals who can succeed in polyamorous relationships. However, he cautions that the research on polyamory often focuses on successful cases, leading to a biased view. He believes that polyamorous relationships may be more challenging than monogamous relationships due to the increased emotional bandwidth required. He also points out that polyamory can sometimes be used as a mask for unresolved issues in a relationship. Dr. K discusses the origins of the term incel and mentions that the first incel was actually a woman. He explains that pornography can contribute to incel behavior by reinforcing negative attitudes towards women and promoting fantasies of dominance and abuse. He emphasizes the importance of addressing underlying issues and resentments that may lead to incel behavior rather than indulging in harmful fantasies. Dr. K shares his perspective on truthfulness, stating that committing to truth can have positive effects on one's life. He believes that lying to protect others or avoid conflict may ultimately be detrimental. He shares his insights on how to approach difficult situations, such as dealing with terminal illness in children, suicidal patients, and the fear of death. He emphasizes the importance of honesty and transparency in communication, even in challenging circumstances. He believes that providing patients with the truth, no matter how difficult, can help them cope and make informed decisions. Dr. K acknowledges that his profession exposes him to a high concentration of negative experiences, such as crisis and tragedy. However, he finds that witnessing individuals overcome their struggles and heal has a positive impact on him. He emphasizes the importance of staying grounded and maintaining tranquility when faced with emotional challenges. He believes that sharing negative experiences can bring people closer together and foster resilience. In the field of psychiatry, Dr. K explains that genetics play a role in predisposing individuals to certain mental health conditions. However, he emphasizes that the environment also plays a significant role in determining the actual outcome. He views genetics as providing a probability, while the environment influences the final result. He believes that a combination of genetic predisposition and environmental factors contributes to mental health conditions. Through his public work, Dr. K has gained insights into the prevalence of subclinical mental health issues. He notes that many individuals struggle with mental health challenges that do not meet the diagnostic threshold for a specific disorder. He highlights the importance of focusing on mental health as a whole rather than solely on diagnosable mental illnesses. He advocates for addressing the mental health needs of individuals who may not meet the criteria for a formal diagnosis. Dr. K acknowledges that individuals have unique ways of processing information and responding to interventions. He emphasizes the importance of personalized approaches to mental health care, tailored to each individual's needs and preferences. He believes that understanding the fundamental aspects of the mind can help in providing effective and personalized mental health treatment.